Which is a hallmark symptom of meningitis? Dry cough, photophobia, chest pain, polyuria. Correct answer is option B, photophobia. What is a major concern when a patient is on ACE inhibitors? Bradycardia, hypokalemia, angioedema, hypernatremia. Correct answer is option C, angioedema. Which symptom is a hallmark of autonomic dysreflexia in spinal cord injury? Hypotension, severe hypertension and bradycardia, tachycardia and fever, flaccid paralysis. Correct answer is option B, severe hypertension and bradycardia. Which finding is most consistent with fluid volume overload? Flat neck veins, hypotension, bounding pulse, decreased urine output. Correct answer is option C, bounding pulse. What is the priority assessment after a lumbar puncture? Respiratory rate, ability to urinate, headache, bowel sounds. Correct answer is option C, headache. What is the best position for a patient during a seizure? Supine with head flat, on the side with head supported, prone with legs elevated, sitting upright. Correct answer is option B, on the side with head supported. A client with myasthenia gravis is at highest risk for respiratory failure, seizures, cardiac arrest, hyperglycemia. Correct answer is option A, respiratory failure. Which lab value is expected to be elevated in a patient with DKA? Serum pH, bicarbonate, serum ketones, hematocrit. Correct answer is option C, serum ketones. A 60-year-old male with a history of smoking presents with a productive cough, weight loss and hemoptysis. Which of the following diagnostic tests will most likely confirm the diagnosis? Chest X-ray, sputum culture, pulmonary function test, bronchoscopy. Correct answer is option A, chest X-ray. Which symptom indicates hypocalcemia? Constipation, muscle twitching, bradycardia, drowsiness. Correct answer is option B, muscle twitching. Which assessment is a priority after a thyroidectomy? Level of consciousness, bowel sounds, signs of hypocalcemia, blood glucose levels. Correct answer is option C, signs of hypocalcemia. Which symptom is an early sign of hypoxia? Cyanosis, restlessness, bradycardia, hypotension. Correct answer is option B, restlessness. Which of the following indicates neurogenic shock? Tachycardia and hypotension, bradycardia and hypotension, tachypnea and pure, warm, flushed skin and bounding pulse. Correct answer is option B, bradycardia and hypotension. What is the most important assessment after spinal anesthesia? Temperature, respiratory rate, leg movement and sensation, bowel sounds. Correct answer is option C, leg movement and sensation. What is the purpose of incentive spirometry? Increase appetite, prevent pneumonia, reduce blood pressure, promote bowel motility. Correct answer is option B, prevent pneumonia. The most reliable method to confirm NG2 placement is injecting air and auscultating, aspirating gastric contents, X-ray confirmation, checking pH. Correct answer is option C, X-ray confirmation. What should the nurse monitor for in a patient receiving TPN? Total parenteral nutrition, dehydration, hypernatremia, hyperglycemia, bradycardia. Correct answer is option C, hyperglycemia. Which of the following conditions is most likely to lead to the development of hyperkalemia? Chronic kidney disease, hyperthyroidism, hypovolemia, asthma. Correct answer is option A, chronic kidney disease. Which complication should the nurse monitor for in a patient receiving thrombolytic therapy for acute ischemic stroke? Thrombocytopenia, bleeding, hypertension, hypokalemia. Correct answer is option B, bleeding. Which term refers to the abnormal accumulation of fluid in the peritoneal cavity? Ascites, edema, pleural effusion, peritonitis. Correct answer is option A, ascites. Which lab value indicates acute kidney injury? Decreased creatinine, elevated creatinine, decreased potassium, low burn. Correct answer is option B, elevated creatinine. Which findings suggest a complication after lumbar puncture? Headache, neck stiffness, hypotension, urinary retention. Correct answer is option B, neck stiffness. Which electrolyte imbalance is most likely to cause peak T waves on an ECG? Hypokalemia, hyperkalemia, hypocalcemia, hypernatremia. Correct answer is option B, hyperkalemia. Which assessment is most important in a patient receiving a blood transfusion? Bowel sounds, skin turgor, temperature, papillary response. Correct answer is option C, temperature. A patient suddenly becomes restless and complains of a sense of doom after a central line placement. What should the nurse suspect? Catheter infection, pulmonary embolism, fluid overload, myocardial infarction. Correct answer is option B, pulmonary embolism. A patient who is recovering from abdominal surgery develops a fever and increased WBC count. What is the nurse's best action? Administer prescribed antipyretics, assess the surgical site for signs of infection, encourage the patient to drink fluids, notify the healthcare provider immediately. Correct answer is option B, assess the surgical site for signs of infection. What is the primary risk for long-term corticosteroid therapy? Hypoglycemia, weight loss, immunosuppression, muscle spasm. Correct answer is option C, immunosuppression. Which of the following is a hallmark sign of left-sided heart failure? Pulmonary edema, ascites, jugular vein distension, peripheral edema. Correct answer is option A, pulmonary edema. Thanks for watching. Subscribe to the channel for the latest informative MCQs.